Valentine's Day. Got to be honest with you, just got a bit of grief from her indoors for doing this. Said I shouldn't be doing it on Valentine's Day. First things first, is the Facebook audio working? 212121. Is the Facebook audio working? We may never know. So we're just going to assume that it is. Hello. Testing. Everybody on Facebook is agreeing that it is working. But anyway, who knows? Instagram, as ever, is working. We got Corinne. Evening. I hope you make it snappy. Not only is it Valentine's night, but I know it's a special day for Mrs. Staiano. You're absolutely right. I'm sure you'd be wanting. Yes, you're absolutely right. I am already in the doghouse, and it is only 9:04. Right. So snappy it shall be. But having said that, on the bright side, this is unprecedented. I've had 2 responses to the sticker on Instagram. And actually, I think someone on Facebook said, is anyone there? So 3 in all, 3 responses to the stuff that went out. So that's unprecedented. So I've got the questions. I don't know how I show them on Instagram, but I've written them down here. So I want to lose a few stone. I'll do the questions that I've got preordained, but I want to lose a few stone. Should I wait before having a breast reduction? So that's an easy one. Yeah, you should. So any sort of body contouring surgery, breast reduction, tummy tuck, breast lift, thigh lift, arm lift, any sort of body sort of body shaping procedure, you should wait before you have the procedure if you want to lose weight. 2 reasons. 1 reason that you will have less complications if your weight is lower. 2 reason is that you will get a better result, because if you're having a breast reduction, for instance, you have a lift as part of the reduction where the spare skin is tightened. The reason you need a lift is because the skin has been stretched by putting on weight or by having children. So that skin's been stretched. The extra weight stretches the skin. So if you do a breast reduction and make the skin as tight as you possibly can, and you then lose weight following that, then it might droop a bit more. So the shape wouldn't be as good as if you had lost weight first. So always lose weight first before any sort of body contouring. But this particular question is referring to breast reduction. So yes, you should do that. The other question was how much to turn a belly button from an innie. No, it wouldn't have been from an innie to an outie, would it? It would have been from an outie to an innie. I've written it down. Anyway, I'm assuming it's not an innie to an outie. Don't think I could do an innie to an outie. But anyway, I'm sure it's an outie to an innie. So how much? Don't know. Probably about £1,000. Probably. I don't know. If you email us or message us, then we'll probably give you a more specific figure, because I haven't got a clue about the numbers, to be honest. Without the fact of the money, I've got enough to worry about without having to worry about that. So yeah, I don't know. It is possible. Well, actually, yeah, I shouldn't have given a knee-jerk response there, because I just thought. I mean, it kind of depends what the problem is, because probably what the problem is that you've got a little umbilical hernia. You've got a little hernia in your belly button, which is causing the outie nature of it, which needs to be repaired. So I'm assuming it's a small hernia, a small umbilical hernia, and not a massive one. Because if it's a massive one, then maybe more expensive, or might. So yeah, send us a photo is the answer. If people want prices for stuff, I mean, obviously we can tell you prices for breast reductions and breast lifts and breast implants and things, because they're a bit more standard. But if you've got a thing like a mole or an innie or an outie or a tattoo is the common one, and you want an idea of price, it's always best to send us a photo. Because if you send us a photo, we can give you a better idea of how much it's going to cost, rather than saying it's going to be this, and then we look at you and think, oh my lord, that's massive, or that's much smaller than we thought. Right, let's get cracking with the questions. Well, we already have, but let's do the preordained ones. How much downtime is needed following mole removal? Depends who you are is the answer to that. I did a big lipoma removal, and I'm saying big one, off a doctor the other day, on last Wednesday it was, and it was yay big, no word of a lie. Actually, maybe it wasn't that big, but it was bigger than that. It was big anyway. It was it was not bigger than a mole, and he was talking about going back in the afternoon. I mean, that's what doctors are like. They're mad. So I told him he shouldn't. If he'd had a mole removal, yeah, you might be able to go back in the afternoon. So, not much downtime needed, really, assuming it's a small mole. I mean, if it's a massive mole, well, maybe that's different. But if it's a, and most moles are not massive. So a mole removal is a relatively straightforward procedure. I would say to you, you should take the day off. I mean, let's be honest with ourselves. What is important in work that you have to go back that day, unless you absolutely love it and you work at a really, I don't know what. Anyway, I can't think of any reason to go back to work the same day. I'd give yourself the day off. But certainly the next day you could go back. If you are doing manual stuff, if you're lifting, heaving, and stuff like that, then you probably want to give yourself about a week, I would say, to let the skin knit together. But I've got that open. But you don't really need to do a huge. You don't need a huge amount of time off work unless you're doing things heavy, or if you're doing dusty environments and you're unable to cover it. But pretty much the day off is it for most mole removals, and a week for anything too heavy. If you're a boxer, a month. I say that because we had a boxer and I did a thing on his nose and he went back to boxing and got punched in his nose and the wound opened up. So let's say a month for that, at least maybe 6 weeks before you get someone punching you in the nose. Yeah. Can you have a tummy tuck and arm reduction at the same time? Yes, you can. I mean, I normally would say, basically the things that people, particularly people who've lost weight, need are arm reduction, breast lift, stroke reduction, tummy tuck, and thigh lift. And I would normally say you can have 2 of those. I think it's reasonable to do 2 of those. Personally, I can't see a situation where I would do 3 of those in one go. So I'd say 2 of those in one go. And the common combinations are ones next to each other. So probably the commonest is a breast and a tummy. They're like next to each other. And then the next commonest would be a breast and an arm, or a tummy with a thigh. So usually things next to each other are commoner for 2 reasons. First of all, it's easier in terms of the operating field and prepping you and draping you. We don't want to sort of expose your whole body because then you'll get cold and things. We have to sort of cover up parts of you. So it's easier from a surgical point of view, but also for a recovery point of view. If your sort of arms hurt and your tummy hurts, it's sort of two sort of distinct areas that are different in different places. So as a rule, I would say places next to each other are more common. Having said that, there's nothing wrong with saying, look, you have a tummy tuck and an arm reduction. That would be a reasonable combination. It's just that, think about it, both your arms are a little bit sore. I would say out of action, but a little bit sore, a little bit tight, and you're all bent over and what have you. So yes, you could have a tummy tuck and an arm reduction at the same time. Not a common combination, but there's no reason to do things just because they're common. I think there's no reason not to do it that way. So yes, that is. Oh, and look at this. That leads me nicely on to what is the recovery for a tummy tuck and an arm reduction. How much downtime is needed? Broadly speaking, let's not be too sort of saying things across the board. What's that word? But there's probably a word for it. But let's not be too saying things across the board. Let's just use that statement rather than using a word for it, because I think you know what I'm talking about. Maybe you don't, but definitely a word for that. Let's not be too generalistic. No. Anyway, but broadly speaking, when you had one of those operations I just said, a tummy tuck and a breast lift or breast reduction, or breast implants, or a tummy tuck and a thigh lift, or a tummy tuck and an arm lift, the tummy tuck, I would say most of the time, the tummy tuck is the overriding thing in terms of the downtime. So usually what happens is your tummy generic, let's not be too generic. Would that fit? Probably better than generalistic or whatever word I used. Thank you, Tommy. Stand by, because I'll probably need you later for more thesaurus work. So let's not be too generic, but usually the tummy is the overriding thing. So the time for recovery for a tummy tuck with an arm lift, or a tummy tuck with a breast lift, or a tummy tuck with a thigh lift is the same as a time for recovery with a tummy tuck. because usually the other thing is sort of healing in the background. Obviously, you might have a problem with your arm lift or your breast lift or your thigh lift, and that might become an overriding problem um, for your tummy, overriding your tummy. I had a patient who had a tummy tuck and a bit of fat removed from the back of her knees. And the overriding problem was the little bit of fat that I removed from the back of the knees. That was a massive problem. Loads of issues, seromas, infection, loads and loads of problems. And the tummy tuck was it's almost like it hadn't happened. But that's rare. Usually the normal recovery period is for the tummy tuck. So that's a week or 2 weeks probably bent over, I would say, average, sometimes longer, sometimes shorter. So you're not really wanting to do much in terms of work the first 2 weeks. Driving, what have you, I normally say 3 weeks. Everyone's different, so these are just sort of ballpark figures. So say no driving for 3 weeks, and then often you can go back to work if you're driving and stuff, but nothing heavy in terms of lifting and things like that for 6 weeks. So and then just starting, it does knock you back a tummy tuck. So then you're just starting at about 6 weeks, and then you sort of build up. And I normally say things sort of start at around 3 months in terms of settling, in terms of the swelling and the scars and the goodness knows what. So so three weeks for driving, 6 weeks for lifting, 3 months for settling in terms of shape and scars and what have you, and the shape and the scars and the sensation of the numb bits and stuff like that. So that can take 6, 12, maybe 18 months, take a long time for that to settle. So it's quite a long haul, really. Tummy tuck. So and as I say, the arm reduction would be healing in the background while that was going on. Do you use drains when doing tummy tucks? Yes. I don't use that many drains anymore, and I'm moving away from drains. And I think the plastic surgery fraternity is moving away from drains, and the plastic surgery fraternity has moved away from drains in tummy tucks. So there are quite a lot of people who are not using drains in tummy tucks, which I am aware of. But I still do. Having said that, I take them out the next day. So I only have them in for a night, so you don't go home with them. So we take them out the next day and then you go home. But I still do. I use quilting stitches to sort of close down the space, which I think is something that means you could potentially stop using drains. A while back in the day, like crumbs, when many years ago, they said we don't need to use drains for tummy tucks. There was a lot of people using glue to stick down the two spaces, and I never really embraced that. I never really embraced the glue. I did a lot of lat dorsi breast reconstructions where you take a tissue from the back and put it around the front. And the similar sort of problem with the lat dorsi as you get with the tummy tuck, in that there's a space where the muscle was, and that space fills with fluids called a seroma. And so you need to close down that space, which is what the drains do. And what they said is you can use glue there to stick the space down so it doesn't fill with fluid. And I never embraced it with lat dorsi, and I never embraced it really with tummy tuck either. So I know people have embraced it, and I know they publish good results and say it's good and it stops drains, which is no. Don't get me wrong, no one likes drains. I don't think anyone will say I like drains. Some people might say they're okay, but most people say, ooh, it's a bit horrible. So if I could get away from using drains, I would. And I am moving that way by doing this quilting thing where you sort of put stitches in the space to close down the space. So it's like like a quilt, I suppose, or like a sort of Chesterfield sofa. So it's got so instead of one big space, it's lots of small spaces. So that is the way to reduce the space and reduce the need for drains. But I'm not there yet. I'm still using them. But so that was a long answer to your question, Kelly. I do still use drains, yeah, but only for the night. Only for a night. Don't be a stranger. So yeah, just for one night, and maybe probably we will all probably stop using drains, I suspect, but I can't get away from it with tummy tucks and capsulectomies and big breast reductions. Those are the sort of main ones I use drains in on a personal basis. It is a personal thing, actually. There's not really a science, and it's not an accepted thing to do. It is acceptable not to use drains, but it is also acceptable to use drains. And So it's just finding a surgeon, really. Thank you. I'm coming to see you tomorrow. I will see you tomorrow then, Kelly, and we can talk about drain usage then. Well, we've done it. We covered drains. We can spend the time talking about other stuff. So looking forward to it already, Kelly. Can't wait to see you tomorrow. Have a good night's sleep tonight. It's a big night tonight, obviously Valentine's Day. Do we offer Botox injections? No. Actually, full disclaimer, Amy wrote the questions. I don't know where Amy is. I don't know if Amy is the one person on Facebook, but we're not allowed to use words like Botox. So we're not allowed. Botox is a prescription drug, and you're not. I mean, I don't know if this is advertising, but you're not allowed to sort of advertise a prescription drug. So you've got to use terms like wrinkle relaxing injections. So Amy, that should say, do we offer wrinkle relaxing injections? So we don't offer wrinkle relaxing injections. No. I tell you what, I mean, I don't know how much you want to get into this. I said we'd keep it short. So basically, the problem is we did, and Vicky's done a course on it, and we got plastic surgeons at the clinic. I've never done it. I'll be full disclosure. I've never done it. Never had any interest in it. Everyone says, "Oh, you should do it. You're a plastic surgeon. You've got to do it. It's really good, and you earn lots of money, and it's really easy money and everything." Well, first of all, there's no such thing as easy money. That's a fact. But the problem, I'll tell you now, just between you and me, is that the cost of the Botox, the cost of the wrinkle relaxing injection. Because if you use the proper wrinkle relaxing injections, there's a couple. I think it costs something like £400 or something for a bottle, and as I say, it's a prescription-only drug, so it's supposed to be prescribed by a doctor for you. The problem is there's a lot of non-doctors doing it, and there's a big thing amongst the non-surgical fraternity. There's a lot of people out there who specialise in this sort of stuff, and my view is I'm going to leave it to them, because I don't specialise in this, and I'm going to leave it to them because they're the experts and they're doing it all the time, and I'll leave that expertise to them, and the surgical stuff is for me. But obviously, I'm in the industry, so I know what's going on, and there's a lot of talk about the people who are doing it, because they're saying that the people doing it shouldn't be doing it if they're not doctors, and most of them are not doctors, because the question is, how do they get the drug? And I think that they have work for doctors who are like saying, I'll prescribe a drug for 50 quid or something, I'll prescribe a drug for you, which they shouldn't really be doing. The doctors should be seeing the patients, and they should be seeing the doctor, or at least speaking to the patients. But I don't think the doctors are ringing. If you have, this is an area I don't know, but correct me if I'm wrong. If you had Botox, but what should happen if you have Botox by a non-doctor? The doctor should be phoning you and speaking to you, then prescribing the drug for you. Then you get the drug, and then you should have the injection. So you're supposed to see the doctor first, and then have the injection later. So you're not supposed to be able to turn up at a one-stop clinic and just get the injection and on the same day, because it's a prescription thing that you're supposed to have prescribed for you, and that's not happening. So, but the main thing I was finding is the price of the wrinkle relaxing injection is very, very expensive, and there's lots of cheap alternatives. You can buy stuff on eBay, quite literally buy stuff on eBay, and I think people are doing that and still calling it this name, but you're not allowed to call it that name because it is not that name. It's something else, and they're charging, I don't know what, £50, £100. When it costs us £400 for the stuff, we can't. It's very hard to compete with that. And I mean, you could say you could compete with that, because you could say we're plastic surgeons and people will pay for that. But we were having to charge an awful lot for it. And it was a difficult, market, if you like, to get into. It has to be people who will pay a lot, and they might say, "Wait a minute, why are you? I don't know what we would, 600 quid or something, and then I can go down the road and get it for 50 quid." And so we're out. Got enough to do with the surgery. So yeah, that was I'm not keeping it very short, am I? That's the wrinkle relaxing question. Oh, here we go. There's another one. Oh god, doom and gloom on Valentine's. I can have my cyst removed elsewhere for 300 quid. Why is your clinic more expensive? Yeah. Yes. This was what I told Amy to put this one on because we got this the other day. I know you can. I know you can. And I guess it's a bit like the wrinkle relaxing injection. Now, I'll tell you now, when we do cyst removal, for instance, it's about £100 for the histology exhibit A. So that's £100 gone. And, if you're going to pay a plastic surgeon to do a cyst removal, I don't know. I don't know how much. I don't know. The answer is I don't know how the other clinics do it. I mean, when we do surgery on people, you only get paid for the surgery, but you've got to take into account everything else. So you've got to take into account consultation for the person, the surgery, the dressings, the post-op consultation. We'll talk to you again with the histology. So for a cyst removal, potentially, you don't have to come for this, but potentially you have a cyst removal, you come for a clinic appointment, we'll talk to you, then we'll do the cyst removal, then you'll have a dressing clinic at a week with the nurse, then you'll have an appointment with me for 6 weeks. Now that can be virtual, but in fact, I prefer real life, so it can be real life for 6 weeks. Probably 6 weeks, your scar's a bit red, probably not quite right. So then we see again at 4 months after that, so at 6 months. And then I might even see you again at a year. And I'll often see, it depends on how. So all those appointments are paid for by the first. We don't charge you for those appointments. So those appointments are a part of the price that we charge. So I think a cyst, it starts with us about 800. So that's 800 for all those appointments. It's not just for the cyst removal. I don't know how it works elsewhere, but I imagine elsewhere you'll just get your cyst removal and that's it. I imagine. I don't know. Maybe they do see you. Maybe they're not plastic surgeons. I don't know. Maybe they are. Maybe they do lots of volume. Maybe they that's how, because we don't do like high volume. So maybe they make it profitable by doing high volume, which is not necessarily a bad thing. But we're quite a bit more relaxed at the clinic. We don't do like loads of ops. We do a see and treat. Again, we do a see and treat service, which I think is adding value. So you can come, have your consultation, have the treat, cyst removal on the same day. If you are doing high volume, you can't do that because someone might say, I don't want it removed today. And you've booked out 2 hours in your clinic. And they say, actually, do you know what? I don't fancy having a scar. I don't want it done. With us, we're like, okay, that's fine. Come back next week, have a think about it. It's fine. But if you high volume, if you want to maximize the theatre availability, you will see people one day and then book them in for a surgery another day. So all those things are why we charge what we charge. And I do know that a lot of people charge less, and I don't know how they do it, to be quite honest with you. But, they might presumably are making a profit, but I don't know how. Maybe they don't send it for histology. Maybe they do. I don't know. Maybe they've got cheaper histology. Because you can't put a price on perfection. Simple. There you go. That's what Corin's answer is. Well, there you go, Corin. That's yeah. Well, I don't know. Can we remove now? See, Amy's put this question in. Can we remove a cyst located in the nostril? What would have been better, Amy, if you'd let me show? I don't know if you are. Oh, there's 3. Oh, I was about to say there's 3 people on Facebook. There's 2 now. Anyway, so I'm not sure this page. So because again, we have to see a photo. So a cyst located in the nostril. So because I could show you 2 photos. I could show you one photo of one that I did remove. It wasn't a cyst. It was a mole just here. But it was an intradermal nevus, which is a sort of raised mole, which can sometimes look like a cyst. So in fact, I don't think this thing was a cyst. But anyway, it's a raised thing just here in the rim of the nostril. The one that Amy showed me, this one, was sort of up inside the nostril. So it's like, oh, look up there, up in my nostril. And so that was a polyp or something. I don't know what it was. I don't know if it was a cyst. Cysts aren't normally sort of protuberant from the skin. Cysts are sort of bumps underneath the skin. So I think this was some kind of papilloma or something. And so I said, no, that would need an ENT surgeon who's used to working inside the nose. We will work at the sort of rim of the nose, but we don't tend to go inside the nose. That'd be an ENT surgeon. So again, I wouldn't say we can't remove a cyst located in the nostril because I don't think this was a cyst. But I would say if you've got a cyst in the nostril, send us a photo and we'll have a look. Because it might be an ENT surgeon, but we'll have a look and we will advise you on that. I am out. That's it. I'm out. So listen, happy Valentine's Day, everybody. Who have a lovely evening. Go and put your feet up, and enjoy the process. And I will be back here. Actually, no, I won't. Thank you for your time. Go and get yourself back in the good books. Yeah. Next week it's half term, so I'm away. So it's a rollover week next week. Okay, so it's a 2-weeker. I will be here the week after next. God only, is that going to be March? Crikey, that might be March, But anyway, whenever it is, I'll be here the week after next. It'll be getting on for March for sure. Kelly Lee still here. Looking forward to seeing you tomorrow. And I will be back week on Tuesday. Got any questions, leave them in the comments below. Don't forget to like and subscribe. Actually, you don't subscribe to these sort of things, do you? Like? You like these? Anyway, don't know, whatever. Anyway, see you in a couple of weeks. I'm going to go and, bit of salsa. God, I look a bit scruffy, don't I? Yeah, anyway, see you next time. Take it easy.